I believe creativity is the most important skill set for a physician. The future physician needs to apply their imagination to think about how to redesign the healthcare system, how to redesign the services that we provide. My parents are immigrants from Korea. We were pretty poor growing up. Growing up without health insurance allowed me to develop empathy for the neediest in our communities. It really motivated me to enter into the field of emergency medicine because we treat all people regardless of the ability to pay. Our health system is broken. It's failing so many communities. We have a lot of gaps in our system. We have patients and communities that can't access the healthcare systems. What I noticed working in the emergency room in Philadelphia, that certain people tended to be sicker in certain geographic locations of our city. And the research supports this, that zip code is the best predictor of how healthy that you would be or how unhealthy that you would be. In order to really empathize for the patient, we need to go to where they actually live, because we know that the social determinants of health and non-medical factors have a greater impact upon overall health than what we do in a hospital or clinic. Going into parks and cleaning up the parks of hypodermic needles so their children could play safely. Doing something simple like that will create health. We don't make communities healthier within the walls of a hospital. We need to go beyond the hospital. We need to think about upstream. What are those factors that are causing people to become sicker? We need to collaborate with urban planners. We need to collaborate with architects. We need to collaborate with our community-based organizations. The opioid epidemic is the crisis of our times. We see and treat patients addicted to opioids coming in with overdoses on a daily basis in the emergency department. CoLab Philadelphia is a project that allows us to go into one of the communities in Philadelphia that is hardest hit by the opioid epidemic.
My hope for this project is that it will be community-driven. They are so invested in really responding to what the community wants to see in their neighborhood, not what a panel of so-called experts thinks that should happen in the neighborhood.
Caring about communities, improving the health of cities and communities should not just be siloed within these specialties, that every physician, every specialist should care about this. That's what inspires me about the Cambridge Health Alliance, that they don't write off people, they don't write off communities, but they make an investment in them, that they will provide more than just traditional medical care, but provide behavioral services, provide mental health services for communities.
The community health and equity curriculum within the Tufts University Family Medicine residency has three major areas of focus. We focus on the social determinants of health, we focus on elements of equity, and we focus on the physician as an advocate, both for their patient and also for the communities and the conditions in which these patients exist.
CHA's mission is really to take care of the underserved population. We're a safety net institution, and when we think about substance use and addiction and the opioid epidemic, these are the people that are the most underserved and the most vulnerable.
The recovery coach in this case, it's important. The idea of having someone, a peer, who have lived experience and that knows the system and went through. The recovery coaches can speak from their heart.
The Recovery Coach program here at Everett Hospital, they take referrals from the inpatient medical surgical units, from the inpatient psychiatric units, and from patients coming into the ED with addiction issues.
From projects, poverty, violence, my own addiction, whoever comes through here, I can connect with them. I find something to connect with them with. Now, whether that's that they're homeless, I've felt that. If they're afraid to go back into detox or they've never been to detox, I've had that fear. My son is a heroin addict, so it's personal to me. So when I have a kid, a young lady coming in, 23 years old, that's my kid.
Addiction is a chronic disease and we should address it as such. So just like we teach our residents to take care of diabetes, we teach them to take care of addiction.
Organizations like the CHA are keeping our communities alive. that they are often the last resort that the most vulnerable in our society have.
Immigrants are scared. I think the greatest effect on immigrant patient lives in terms of health is dropping out of the healthcare system altogether.
I think we felt that this is a particular group of patients that we wanted to outreach to more and be really specific about our commitment to their healthcare. All patients, no matter what sort of diverse identities they come to the system with, that we would care for them. The work of our interpreting service at CHA, which is another thing that I think when I first came here, I was absolutely astonished at the number of languages that we offer care in and the kind of attention that's given to that.
We utilize interpreter services a lot at CHA. I think it's a real asset that we have here. The Cambridge Integrated Clerkship at Cambridge Health Alliance is a unique program for medical schools, whereas instead of doing discrete block rotations in each specialties, we get to see the specialties along the continuum of care kind of throughout the year. And what's really special about it is that we get to follow patients. A specific example is with my cancer patient, Cecilia. After her diagnosis, they decided that she needed radiation treatment. Knowing Cecilia and knowing her background, I knew it was going to be difficult for her to get over there. And we were able to provide her with a T-Pass through the Champion Fund, as well as cab vouchers to get home after treatment.
El involucramiento de Kelly con mi cuidado es algo especial. Siento y creo, perdóname Señor, que es un ángel que Dios me mandó del cielo. Ella siempre ha estado conmigo en mi radiación aquí, siempre ha estado conmigo, dando el seguimiento con palabra y con todo eso. Y además de eso, la primera vez que fui a darme la radiación, Kelly fue a buscarme a mi casa. Gracias, Kelly. Me llevó al hospital con una tarjeta de tren para enseñarme la dirección correcta, cómo podía llegar.
Even though we have a lot of medical resources in Boston, a lot of these patients wouldn't be able to receive care if it wasn't for CHA. So the donations are incredibly important for our population.
Honoring the son of an immigrant sends an important message. This is something that we need to communicate over and over again. We are all immigrants. We are all welcome.
Dr. Banku and Cambridge Health Alliance share a lot of similarities around the idea of co-production of health. That if we're not partnering with our patients and understanding their needs, we're not going to be able to meet them well.
You know, issues in healthcare are complicated and, you know, people are very resistant to change. And he's someone who sees that, but then also sort of makes it fun to think about these things.
He's the one who's discovered these convergences between design and healthcare, and he's willing to champion those as legitimate areas to research.
My design experience and my experiences with him and the whole team here have really shaped the kind of physician I want to be.
It's not enough just to take care of patients within the walls of a clinic or a hospital, but that we need to go beyond that. We need to think about caring for the communities where they came from. And that is something that I think will move the needle in healthcare.